Have you ever imagined being completely alone when a heart attack strikes, unsure of what to do? As every second count sits a terrifying scenario that happens more often than you might think. And the truth is, the first few minutes can mean the difference between life and death. In this video, we'll guide you through 7 simple life-saving steps you must take if a heart attack hits and you're on your own. No medical training or fancy equipment required. Watch until the end because the final steps are the ones most people overlook, yet they could be the key to saving your life. Before we begin, I would appreciate it. If you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. Number 1, recognizing the earliest warning signs. The cornerstone of surviving a heart attack, particularly when you're alone, lies in your ability to identify its earliest warning signs and respond promptly. A heart attack is not always the dramatic, unmistakable event portrayed in Hollywood films where someone clutches their chest in agony and collapses. In reality, the onset of a heart attack can be deceptively subtle, with symptoms that are easy to dismiss as insignificant or attributed to less serious causes like stress, indigestion, or fatigue. Understanding and recognizing these early indicators across your entire body, not just your chest, is critical to taking life-saving action before the situation escalates. The hallmark symptom of a heart attack is often a sensation of deep, uncomfortable pressure or squeezing in the center of your chest. This feeling may not be overtly painful, but can resemble a heavy weight pressing down on you, as if an invisible force is compressing your rib cage, or your chest is gradually filling with a dense, unyielding substance. The sensation might persist for several minutes, or it may come and go in waves, tempting you to downplay its severity. However, if this pressure lasts more than a few minutes or occurs intermittently, it's a red flag that demands immediate attention. Beyond chest discomfort, heart attack symptoms can manifest in a variety of ways, affecting different parts of the body. Shortness of breath is a common early sign even in the absence of chest pain. You might feel as though you've just climbed several flights of stairs or run a short distance despite being at rest. This breathlessness can be subtle at first, making it easy to overlook, but it's a critical clue. Other symptoms include pain or discomfort radiating to areas such as the arms, often the left arm, though the right can be affected too, shoulders, neck, jaw, or even the upper back. This pain may feel like a dull ache, burning sensation, or a sharp, fleeting discomfort. Additional warning signs can be even less obvious. Some individuals experience lightheadedness, dizziness, or a sudden sense of unease as if something is fundamentally wrong. A cold clam. My sweat unrelated to physical exertion or room temperature is another telltale symptom. Nausea, vomiting, or a vague sense of abdominal discomfort may also occur, particularly in women and older adults who are more likely to experience atypical symptoms. In fact, for these groups, the discomfort may present as a pressure or fullness in the upper abdomen or back, rather than the chest, further complicating recognition. To illustrate, consider the case of Richard, a 74-year-old retiree. While sitting at this kitchen table one morning, he noticed an unusual tightness just below his collarbone, reminiscent of heartburn but oddly persistent. Moments later, he found it difficult to take a deep breath, and his palms became clammy with sweat, recalling an article he'd read about the varied presentations of heart attacks. Richard resisted the urge to dismiss his symptoms as indigestion or fatigue. Instead, he took action, a decision that likely prevented a fatal outcome. His story underscores a vital truth. The body often signals danger quietly before it erupts into a full-blown crisis. Those subtle whispers are your window of opportunity to intervene before irreversible damage occurs. Waiting for the stereotypical cinematic chest-clutching moment is a dangerous gamble. By the time symptoms become severe, the heart muscle may already be suffering significant oxygen deprivation, reducing your chances of survival. Therefore, if you experience a combination of symptoms such as chest pressure, shortness of breath, unusual fatigue, or discomfort in other parts of your body, pause immediately. Do not attempt to power through or rationalize the sensations as something benign. Even if the symptoms seem mild or fleeting, they warrant serious consideration. To prepare yourself, familiarize yourself with these warning signs in advance, especially if you have risk factors such as high blood pressure, high cholesterol, diabetes, a family history of heart disease, or a history of smoking. Discuss your risks with a healthcare provider and keep a mental checklist of symptoms to reference in a moment of doubt. The ability to recognize and act on these early warning signs is your first and most powerful defense against a heart attack. Treat every unusual symptom with the gravity it deserves. Your life may hinge on that decision. If you are still watching this video and finding these lessons useful, please comment number 1 below. To let me know that you are still watching this video with me, thank you for your valuable time. Number 2. Calling emergency services immediately. Once you suspect that you might be experiencing a heart attack, your immediate Nexus DP without a moment's hesitation is to call 911 or your local emergency services number. This action is non-negotiable. Regardless of whether you're certain it's a heart attack or merely suspect it, do not wait to see if the symptoms subside. Do not attempt to drive yourself to the hospital, and do not worry about the possibility of overreacting. Every second counts during a heart attack, and calling for professional help is the single most effective step you can take to maximize your chances of survival. A heart attack occurs when blood flow to a portion of the heart muscle is blocked, depriving it of oxygen. The longer this deprivation persists, the more extensive and irreversible the damage becomes. By calling 911 immediately, you activate a chain of life-saving interventions. Emergency medical services (EMS) personnel are trained to respond swiftly, arriving with critical equipment such as defibrillators, oxygen, and medications like aspirin or nitroglycerin that can stabilize your condition. They can also perform life-saving procedures such as cardiopulmonary resuscitation, CPR, or defibrillation if your heart stops en route to the hospital. Attempting to drive yourself to the hospital is one of the most perilous mistakes you can make. If your symptoms worsen, as they often do, rapidly, you could lose consciousness, endangering yourself and others on the road. Similarly, asking a family member or friend to drive you may delay care, as they cannot provide the medical interventions available in an ambulance. EMS teams, on the other hand, begin treatment the moment they reach you, effectively bringing the emergency room to your doorstep. They also alert the hospital in advance, ensuring that a cardiac team is ready to receive you upon arrival, which can shave precious minutes off your treatment time. Consider the experience of Linda, a 78-year-old widow living alone. One evening, she noticed a peculiar ache in her left shoulder, followed by a wave of nausea and a cold, sticky sweat. Initially, she considered calling her son for advice, but she recalled a nurse's emphatic advice. If you're alone and think you might be having a heart attack, call 911 first. Contact your family after help. Isen the way. Following this guidance, Linda dialed 911. By the time the ambulance arrived, her symptoms had escalated, with increasing chest pressure and difficulty breathing. The EMS team quickly administered oxygen and medications, stabilizing her condition before transporting her to the hospital. That single phone call made without delay was the difference between life and death. You don't need absolute certainty to justify calling emergency services. EMS dispatchers and paramedics are trained to handle uncertainty and would prefer to respond to a false alarm than miss a chance to save a life. If you're unable to speak clearly due to symptoms, most modern smartphones offer an emergency call feature that can be activated even from a locked screen. Familiarize yourself with this feature in advance and ensure your phone is always within reach, especially if you live alone or have risk factors for heart disease. Some devices also allow you to store emergency medical information such as pre-existing conditions or medications, which can assist responders. To further prepare, consider keeping a list of emergency contacts and your medical history near your phone or in a visible location such as on your refrigerator where EMS personnel can easily find it. If you live in an apartment building or gated community, ensure that responders can access your location by providing clear instructions to the dispatcher or arranging for a neighbor to assist. The goal is to eliminate any barriers to receiving prompt care. Ultimately, calling 911 is not just about getting help. It's about giving yourself the best possible chance to survive a heart attack. Act decisively, trust your instincts, and let trained professionals take over. Your quick response could mean the difference between a full recovery and a tragic outcome. Number 3. Chewing an aspirin slowly and calmly. In the critical moments following the onset of a suspected heart attack, after promptly calling emergency services, one of the most effective and accessible actions you can take is both simple and profound. Chew an aspirin. This isn't about swallowing a pill whole in a hurried gulp. It's about chewing it slowly and methodically, even if your hands are trembling or your mind is racing with fear. If you have a standard 325 milligram aspirin tablet available and you're not allergic to aspirin or taking medications like blood thinners that might contraindicate its use, this single deliberate act can dramatically improve your odds of surviving a heart attack and minimizing long-term damage to your heart. Aspirin's power in this scenario lies in its ability to act as a blood thinner. During a heart attack, a blood clot often forms, obstructing one of the coronary arteries that supply oxygen-rich blood to the heart muscle. This blockage is the root cause of the heart attack, starving the heart of oxygen and causing tissue damage. By chewing an aspirin, you enable its active ingredient acetylsalicylic acid to enter your bloodstream more rapidly than if you swallowed it whole. Chewing breaks the tablet into smaller particles, allowing it to dissolve and absorb quickly through the mucous membranes in your mouth and stomach. Scientific studies have demonstrated that this method can begin thinning the blood within minute, potentially slowing or preventing further clot growth. In some cases, this rapid action can even restore a degree of blood flow to the heart muscle, buying precious time until paramedics arrive with advanced interventions. To maximize the effectiveness of this step, it's crucial to use uncoated immediate release aspirin if possible. Coated or delayed release aspirin tablets designed to protect the stomach lining take longer to break down and absorb, which can delay their life-saving effects. If all you have is a coated tablet, chew it anyway. Speed is paramount in this situation. Ideally, you should avoid taking aspirin on an empty stomach to reduce the risk of gastrointestinal irritation. But during a heart attack, the immediate threat of a clot far outweighs this concern. Always consult with your doctor in advance to confirm whether aspirin is safe for you, especially if you have a history of bleeding disorders, ulcers, or are on medications like Warren or other anticoagulants. Consider the real-life example of Joe, a 72-year-old retiree who experienced a heart attack one quiet morning. As he sat at his kitchen table, a sudden tightness gripped his chest, radiating upward to his neck and jaw. Despite his rising panic, Joe recalled a conversation with his doctor about aspirin's role in heart attack survival. He shuffled to his kitchen cabinet, retrieved a bottle of 325 milligram aspirin and chewed one tablet slowly while sitting calmly and waiting for the ambulance he'd called. Later at the hospital, his cardiologist explained that this simple action likely reduced the extent of the clot in his coronary artery, limiting the damage to his heart muscle. Joe's story underscores the profound impact of a small, informed decision made in a moment of crisis. To ensure you're prepared for such an emergency, take proactive steps. No, store aspirin in easily accessible locations, such as your nightstand kitchen drawer, bathroom cabinet, or even a small container in your purse or wallet. Check the expiration date periodically, as expired aspirin may be less effective. Inform your family members or close friends where you keep your aspirin so they can assist you if needed. If you live alone, this preparation is especially critical as every second counts. Emergency medical professionals worldwide endorse this practice, and it's a standard protocol in many heart attack response guidelines. Chewing an aspirin isn't just a helpful tip, it's a scientifically validated intervention that can mean the difference between a full recovery and a tragic outcome. If you are still watching this video and finding these lessons full, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 4, sitting or lying down to protect your heart. Once you've called emergency services and chewed an aspirin, your next priority is to protect your heart by minimizing its workload. This means stopping all physical activity immediately and positioning yourself in a way that conserves energy and optimizes blood flow. Sit down or lie down in the safest, most comfortable position you can manage and resist the urge to move unnecessarily. This is not the time to pace anxiously, tidy up your surroundings, gather personal belongings, or unlock doors unless it's essential for paramedics to access you. Every step, every exertion increases the demand on your heart, which is already struggling to pump blood effectively due to reduced oxygen supply. The ideal position is to sit with your back supported against a wall chair or headboard with your feet flat on the ground and your arms resting loosely at your sides or on your lap. This posture reduces the gravitational strain on your cardiovascular system, allowing your heart to pump blood with less effort. Keep your shoulders relaxed and your breathing steady to avoid tensing your muscles, which can inadvertently raise your blood pressure. If you feel faint, dizzy, or lightheaded, common symptoms during a heart attack, lie down on your side, preferably your left side, with your head slightly elevated on a pillow or folded clothing. This position can help maintain blood flow to your brain and heart while reducing the risk of choking if you become nauseous or lose consciousness. Avoid lying flat on your back unless instructed by emergency personnel, as this can sometimes make breathing more difficult. It's natural to feel a mix of embarrassment, denial, or even guilt. In these moments, many people hesitate to do nothing after calling for help, worried they're overreacting or burdening others. But in the context of a heart attack, doing nothing is a powerful act of self-preservation. By remaining still, you lower your heart rate, reduce oxygen consumption, and give your body a chance to stabilize. This intentional stillness can prevent your symptoms from worsening and in some cases may avert a progression to full cardiac arrest. Take the example of Alice, an 81-year-old grandmother who experienced a heart attack while preparing breakfast. As a heavy pressure spread across her chest, accompanied by a clammy sweat, her first instinct was to push through the discomfort, clean the kitchen, and get herself together before calling for help. But a memory surfaced of her doctor's advice. If you think it's your heart, stop everything and sit down. Nothing else matters. Heeding this wisdom, Alice lowered herself into her favorite recliner, propped her back with a cushion, and focused on breathing slowly while waiting for the ambulance. Later, her medical team credited her decision to remain, still with preventing a dangerous escalation of her symptoms, allowing her to undergo treatment without complications. To make this step easier, in a crisis plan, identify safe, comfortable spots in your home where you can sit or lie down quickly, such as a sturdy chair with armrests or a couch with pillows for support. If you're in a public place, look for a bench wall or even the ground if necessary. Avoid chairs without back support, as slumping can constrict your chest and make breathing harder. Maintain an upright or upright posture to keep your airways open and reduce the effort required to breathe. If you're with others, ask them to help you get into a stable position and to stay calm, as their reassurance can help you stay focused. In those critical first minutes of a heart attack, every decision counts by sitting or lying down and staying still. You're not just waiting passively, you're actively giving your heart its best chance to endure until help arrives. Combined with calling emergency services and chewing an aspirin, this step forms a trio of actions that can profoundly influence your survival and recovery. Number 5. Unlocking your door. For emergency responders, amid a medical emergency, every action you take can significantly impact the speed and effectiveness of the help you receive. One often overlooked, but critical step is unlocking your front door for emergency responders. If you've managed to call 911 and are still able to move after settling into a safe position, taking the few seconds to unlock your door can make a profound difference. While it may seem like a minor task in the grand scheme of a crisis, those seconds are precious when time is of the essence, and a locked door can delay life-saving treatment. Emergency medical technicians, EMTs, and paramedics are trained to gain entry by force if necessary, using tools to break down doors or windows. However, this process introduces unavoidable delays, causes property damage, and can pose risks. For instance, if you're near the door, the noise and suddenness of forced entry could startle you, potentially exacerbating your condition or causing injury. By unlocking the door in advance, you eliminate these obstacles, allowing responders to enter swiftly and begin administering care immediately. In some cases, this simple act can shave minutes off the response time. Minutes that could be critical to your survival, particularly in conditions like a heart attack where every second counts. For those living alone, especially in apartments, gated communities, or homes with complex entry systems, pre-planning is essential. Consider the logistics of your home before an emergency strikes. Is your door easy to unlock and open from the inside even under stress? Do you have a deadbolt that requires a key or a simple latch? Is your address visible from the street, ensuring responders can locate your home quickly? If you're in a multi-unit building, is there a call box or gate code that could slow down access? Some individuals keep a spare key with a trusted neighbor or in a secure, accessible location such as a lockbox designed for emergency use. Medical lockboxes, which store a key and area accessible via a code provided to dispatchers, are particularly useful for those with mobility challenges or who live alone. Take the example of Paul, a 76-year-old retiree living in a small condominium. When he began experiencing chest pain and shortness of breath, he immediately recognized the signs of a potential heart attack. After calling 911 and chewing an aspirin as recommended, he made the quick decision to unlock his front door. This took him less than 30 seconds but proved invaluable. When paramedics arrived, they were able to enter his home without delay, bypassing the need to force open a locked door. Later, the paramedics noted that this action saved them approximately 30 seconds time that allowed them to stabilize Paul and transport him to the hospital faster. Reflecting on the experience, Paul admitted, "In that moment, unlocking The door was the last thing on my mind, but I'm so glad I did it. It might have been the difference that kept me alive. If you're unsure about your ability to reach the door safely, prioritize your safety above all else. Moving during a medical emergency can be risky, especially if you feel dizzy, weak, or unsteady. In such cases, stay seated, focus on slow breathing, and communicate your location clearly to the dispatcher. However, if you're near the door and feel stable enough to unlock it without endangering yourself, doing so can be a proactive step. For added convenience and safety, consider investing in a smart lock with remote access capabilities, which allows you to unlock your door via smartphone app or share access with responders. Alternatively, a medical lockbox can provide peace of mind, ensuring that responders can enter even if you're unable to reach the door. This small act of preparation sends a powerful message to the emergency team rushing to your aid. You've done everything in your power to help them help you. By removing barriers to entry, you pave the way for faster, more effective care, potentially making the difference between life and death. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 6. Using your phone speaker or medical ID features. During a medical emergency, your smartphone transforms from an everyday device into a critical lifeline, connecting you to help and providing vital information when you may not be able to speak for yourself. Two key features can significantly enhance its utility in a crisis: the speakerphone function and the medical ID feature. Using these tools effectively can streamline communication with emergency responders and ensure they have the information needed to provide the best possible care. When you call 911 during a heart attack or similar emergency, switching your phone to speakerphone as a simple but highly effective strategy. Holding a phone to your ear requires physical effort, which can be taxing when you're experiencing symptoms like chest pain, shortness of breath, or weakness. Speakerphone allows you to communicate, hands-free, freeing you to focus on staying calm, breathing slowly, and following the dispatcher's instructions. This reduces physical strain and helps conserve your energy for critical tasks, like maintaining consciousness. Additionally, speakerphone improves the quality of communication. If your condition worsens and you become too weak to speak clearly, the dispatcher can still hear you breathing, moving, or attempting to respond. These auditory cues provide valuable insight into your condition, allowing the dispatcher to relay important details to their responding paramedics. For example, changes in your breathing pattern or sudden silence can alert them to the urgency of your situation. Speakerphone also ensures that the dispatcher's voice is audible without requiring you to keep the phone pressed to your ear, which can be reassuring as they guide you through the wait for help. Equally important is your phone's medical ID feature, a built-in tool available on most modern smartphones. On iPhones, the medical ID is accessible from the lock screen via the emergency SOS feature, while Android devices offer similar functionality, often through the emergency information settings. This digital profile allows you to store critical health information, including your full name, date of birth, blood type, allergies, current medications, medical conditions, and emergency contact numbers. If you lose consciousness or are unable to communicate when paramedics arrive, this information can guide their treatment decisions, potentially preventing dangerous errors and saving time. Consider the case of Susan, a 79-year-old woman with diabetes and a penicillin allergy. When she suffered a heart attack, she called 911 but lost consciousness just before paramedics arrived. Fortunately, Susan had set up her phone's medical ID, which the responders accessed from her locked device. Within seconds, they learned of her diabetes, her allergy to penicillin, and her daughter's contact information. This allowed them to avoid administering penicillin-based medications, which could have triggered a severe allergic reaction, and to notify her daughter immediately. Susan later credited her survival to this preparation, noting, "I never thought something so simple could make such a big difference." Setting up your medical ID is a quick process that takes less than 5 minutes but provides lasting benefits. To do so, open your phone's health or emergency settings. Input your details and ensure the feature is enabled for lock screen access. Include key information, such as this: preparation is not just for tech-savvy individuals. It's for anyone who might one day need emergency care. By using speakerphone and setting up your medical ID, you ensure that your phone serves as both a communication tool and a silent advocate speaking for you when you cannot. In those critical moments, these features can bridge the gap between crisis and care, helping responders act swiftly and effectively. If you are still watching this video and finding these lessons useful, please comment number 4 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 7. Slowing your breath to steady your heart. When a heart attack strikes, the overwhelming sensations of pain, fear, and uncertainty can make it feel as though your body and mind are spiraling out of control. Your chest tightens, your pulse races, and panic threatens to take over in these moments. One of the most powerful tools at your disposal is also one of the simplest: your breath. By practicing control breathing, you can calm your nervous system, reduce stress on your heart, and increase your chances of staying stable until help arrives. Controlled breathing is not a cure for a heart attack, nor will it reverse the underlying medical issue. However, it serves a critical purpose by helping your body avoid escalating into full-blown panic or shock. Anxiety and stress trigger the release of adrenaline, which can accelerate your heart rate and exacerbate irregular rhythms, potentially pushing your heart into dangerous territory. By slowing your breathing, you activate the parasympathetic nervous system, which counteracts this fight-or-flight response and promotes a calmer physiological state. This can help maintain oxygen flow, reduce the heart's workload, and prevent complications like arrhythmias while you await emergency care. A simple yet effective breathing technique involves the following steps. Inhale slowly through your nose for approximately 4 seconds, allowing your chest to expand gently. Hold your breath for a brief moment, about 1 to 2 seconds. Exhale slowly through your mouth for 6 seconds, focusing on releasing tension with each breath. Repeat this cycle, concentrating on the rhythm of your breathing. This method, often referred to as diaphragmatic or box breathing, provides a focal point to anchor your attention, distracting you from panic and grounding you in the present moment. It's not about forcing deep breaths, but about maintaining a steady, controlled rhythm that feels natural. Frank, an 83-year-old retiree, experienced the benefits of this technique firsthand when he began feeling intense chest pain and shortness of breath. Panic set in, making him feel as though he was drowning in fear. Fortunately, Frank recalled a breathing exercise his cardiologist had taught him during a routine visit. Sitting still, he focused on slow, deliberate breaths, counting each inhale and exhale. This helped him stay calm and avoid hyperventilation, which could have worsened his condition. When paramedics arrived, they noted that while Frank's heart was still in distress, it had not progressed to full cardiac arrest. Reflecting on the ordeal, Frank said, "I kept telling myself, breathe, stay calm, stay alive." That focus made all the difference. You don't need to wait for an emergency to practice controlled breathing. Incorporate it into your daily routine while relaxing at home during moments of stress, or even as part of a mindfulness practice. The more familiar the technique becomes, the more instinctively you'll turn to it in a crisis. For example, try practicing for a few minutes each day, perhaps while sitting in a quiet space or before bed. Over time, this habit can become second nature, equipping you with a reliable tool for high-stakes situations. While controlled breathing won't repair damaged arteries or stop a heart attack, it can buy you precious time by keeping your body as stable as possible. It ensures that oxygen continues to circulate, reduces the strain on your cardiovascular system, and helps you maintain a sense of control in an otherwise chaotic moment. In the critical window, before help arrives, this small act of self-regulation can be the edge you need to stay alive. Focus on your breath. Stay still and trust that help is in the way. Thank you for joining us today as we walk through these 7 critical steps to survive a heart attack when you're alone. Now, we'd love to hear from you. What stood out to you the most? What's one thing you've learned from this video that you'll put into practice in your life? Please share it in the comments below. Your thoughts inspire us and others. If you like this video, please leave your comment below and don't forget to like, share, and subscribe to your YouTube channel, Graceful Aging, for more life-saving content. Stay prepared, stay safe, and we'll see you in the next video.